Thank you for the introduction. I think it's a paradox that somebody trained in the BC era, I'm not talking of before Corona, I'm talking of before computers. I strongly believe that in my lifetime, not only in the lifetime of my children, but in my lifetime, the metaverse is going to become an integral part of the healthcare system, even in India and including neurosciences. I'm going to spend the next 15-20 minutes and going into the history of the future. The Greek word meta implies with, among, after, beyond, that is transcending reality, as in the term metaphysics. Metaverse is the interface where users are immersed in what now appears to be a make-believe world, but with visual, auditory, and even sensory inputs. It is amazing that in the last 22 years, there have been 34,000 indexed articles dealing with some aspect of the metaverse. And in the last 2 years, almost 20% of these articles have been published in the last 2 years. You will be amazed to know that there are at least 25 to 30 clinical applications using various forms of the metaverse. Many of us may not be aware that the COVID pandemic was restrained in many countries, including India, by using augmented reality, virtual reality to train healthcare providers. And this is recommended by the World Health Organization. As you can see in this slide, metaverse essentially...
We are not seeing your slides, please.
Are you able to see the slide?
No, not yet.
I'm able to... Sorry, let me...
You need to share screen, sir.
So I know I did that. Just one sec. Are you able to see it?
Yeah, you can now highlight.
Are you able to see it?
Yes, we can see.
Okay, fine. I don't know why that happened. Okay, fine. So as I was talking, these are the clinical applications using the metaverse. So the metaverse is a broad term given to the combination of artificial intelligence, virtual reality, augmented virtual reality, extended virtual reality, the Internet of Medical Things, what we call Web 3.0, robotics, quantum computing, and so on. This is derived by the convergence of virtual and physical space where users can interact within a make-believe augmented world to meet each other virtually. Thus, I can actually immerse myself in performing an activity with you, which gives a real life experience. The word metaverse was actually introduced in 1992, but even as early as 1982, the concept of characters being transported into an alternate reality inside a computer was thought of. In 1999, movies were released with the metaverse. The word meta really took origin just 2 years ago, 1.5 years ago, when Facebook renamed its company as Meta. And you will see in the next few slides its implication in healthcare. A digital twin. I was fascinated when I was preparing for an article which was published incidentally. The full article, if anybody is interested, is freely available in Apollo Medicine, a PubMed Index journal. So the digital twin is a 1:1 copy of all health data, like a Xerox copy, a photocopy. Now you need to understand this very carefully. In the years to come, electronic medical records, hospital information systems is going to be used in 75 to 80% at least of the healthcare systems in India. Already, there are several million people, I'm talking of India, wearing wearable devices, and big data is something which is happening in the real world. All this information can be collected, projected, stored in cloud services, anonymized data. Of course, the patient needs to give permission. The National Digital Health Mission, Ayushman Bharat, has already made a tremendous start. Of course, this is going to take many, many years. Imagine if take me for example, during the last 72 years of my life, if every single health encounter I have had is uploaded in the cloud. I've already started doing this for the last 5 years. Whatever I've had problems is now available digitally. But imagine if my grandson had started doing this from even before he was born. His mother had uploaded the antenatal ultrasound and so on and so on. There will be trillions of data points, not billions, but trillions of data points. So in the future, particularly for less complex disorders, the doctor, the healthcare provider, will not be somebody in blood like you and me, in flesh and blood, but the doctor will be an algorithm knowing millions of patients better than any actual doctor. Let's take acoustic schwannomas. Even the most experienced neurosurgeon in India probably would have operated on 1,000, 1,500 acoustic schwannomas. If the data from a 500,000 acoustic schwannomas, preoperative MRI, intraoperative findings, postoperative biopsy, follow-up of 5 years, 10 years, every single bit of data point is available. And with artificial intelligence, you will be able to do predictive analytics. You will be able to take out what the human brain just cannot do. Next time you see a patient with a suspected acoustic schwannoma and you confirm the diagnosis on image-wise, you will be matching him. The metaverse will match this particular patient to the most appropriate patient from among this database of 150,000 acoustic schwannomas, and that is how medicine of the future is going to be used. Metaverse is going to change the relationship between people and technology. Users now experience themselves within or alongside virtual content, not just interacting with digital products. A digital twin is a highly complex virtual model of an exact counterpart, the Xerox copy of a physical object. It is amazing what the aeronautical industry, the automobile industry are already doing with digital twins. Now let's come back to humans. Sensors on the physical asset, namely me, collect data, and this is transferred. My genomic analysis. Today, it is not difficult to have a detailed genomic study with just 2 ml of blood or even with a buccal smear. Clinical data and real-time changes. So what is going to happen is when one falls ill, the doctor is going to have access to a virtual profile, not me physically, but everything about me on the cloud, and this would be computationally treated. So the treatment would actually be tried, virtually tried on my digital twin, and then the algorithm will tell you, look, this guy would have cerebral edema. He falls in that 1% of Alzheimer's disease who, when exposed to this drug, will get cerebral edema, and therefore, I don't think we should prescribe this drug. Now, this sort of information will be given on real-time, evidence-based scientific data, and no longer will the doctor have to rely on his so-called hunches. The avatar, the digital avatar, Avatar Medical is a company which already has started patient avatars to help surgeons visualize medical images. There are at least 15 startup companies, including several in India. As a member of the Department of Biotechnology, I've been part of the committee which has funded Bangalore-based startup companies. Two Bangalore-based startup companies have been funded by the DBT for whole body digital twin to assist individuals in the management of chronic metabolic diseases. Improving quality of life for dementia patient. Imagine a dementia patient wearing a virtual reality headset, a head-mounted display, and this head-mounted display takes him back to what was the environment when he was 15 years old, when he was 40 years old. This is not seeing a photograph of the village in which he was born. This was actually an immersion experience, and he will be able to see his parents, his grandparents, his uncles, his aunts, everybody in 3D as an avatar in a holographic image. This has already been used in the management of dementia patients. Hospitals of the future will be designed within hours on a computer, allowing visualization of people, equipment, surgical setups. You know exactly what happens when the operating microscope is placed here, if it is placed 4 feet away, and so on and so forth. What took us decades to learn, today, the wisdom of all the mistakes which all the neurosurgeons in the last 100 years have been made will be available to you at the click of a button. This is not theory. This is actually happening. Of course, it will take 10 to 15 years because it becomes integrated in our healthcare practice. Haptic glove technology allows touch sensation to be experienced. More than 12 years ago, when I was in the University of Stanford for a few days, I experienced the haptic glove technology. Of course, it was very crude at that time. Today, it is far more advanced. Specific uses, as you can see, Philips and Siemens have already marketed digital twins of the human heart to simulate cardiac catheter interventions. My interventional cardiology friends tell me that this is how they learned, and this is what they use today to replace an aortic valve, to replace a mitral valve percutaneously. Cardiology, interventional cardiology is in the forefront of the use of digital twins. Another company called Dassault Systems from Germany has again created a specialized digital heart model, a pediatric heart, an elderly heart, and so on. Surgeons today can calculate the shape of a cuff between the heart and its arteries. SIM and cures, of course, this is what I have no personal experience. I'm sure there are some members in the audience probably who are aware of it. Neurosurgeons today, I understand, can treat simulated aneurysms, resulting in better preoperative strategies. The angiogram, the DSA, the MRI, everything is superimposed of that particular patient. We are not talking of a hypothetical model, and even what sort of clip you are going to apply. If it is interventional, what is the interventional procedure? Everything will be simulated preoperatively. So the next day when you actually do the procedure in the theater, it will just be a rehearsal. Who is using World Health Organization is using smartphones for last 3 years. They have trained COVID-19 responders in the most undeveloped countries in the world. They have been using highly sophisticated smartphones, projecting veins onto a skin for easier drawing of blood, and so on and so forth. At least 30 clinical applications using augmented and virtual reality. Of course, there are challenges. It's very easy to give a lecture. Today, when we still don't have good connectivity in a major part of the country, one can be a pessimist. One can also be an optimist and say, if 5G is going to come in the next 6 months in the metros of India, why can't we have connectivity even in the towns of India in the next 5 to 10 years? I personally am very optimistic, and I'm sure in 5 years, we will be the most connected society in the entire universe. Digital health as products and solutions, giving patients and providers the ability to create and interact with digital content. The medical health ecosystem requires a profound digital transformation in workflow, practice, and delivery methods. I'm not going to, you can see read the slide yourself. I'm not going to read out every single point, excepting to tell you that biological tissue modeling, 3D visualization, all this are affected. Psychiatrists have used augmented virtual reality with excellent results. There are a number of papers published, PubMed Index peer-reviewed journals with a good follow-up on how phobias, anxiety, depression, all this can be managed using technology. About a year and a half ago, Johns Hopkins performed its first augmented reality. Now, please understand this is different from virtual reality. Augmented reality is where in a make-believe environment, you use a patient-specific data, an ossified posterior longitudinal ligament, for example, here, and using this, as these slides do not really convey what the surgeon would have been seeing using a head-mounted display, but you can get a rough idea of how the new augmented reality technology enables a spine surgeon to, in 3D format, exactly place the screw where it is to be needed. This is one of the most amazing things which was done in Seoul a year ago. It is absolutely amazing. 280 cardiac surgeons from 60 different countries, each wearing a head-mounted display in the comfort of their hospitals. Some of them are even in their homes, were able to look at a giant screen. You can see on the bottom left, a surgical scene in the smart operating room where they were able, with their mouse, they were able to actually move and get inside the descending branch of the inferior coronary artery. 280 cardiac surgeons from 80 different countries, they were able to see, while the surgeon in Seoul actually went on giving a live commentary. This is how I think the future of neurosurgical training is going to be. And interestingly, for some strange reason, it is neurosurgeons who have taken a lead in the deployment of technology, not only in India, but most countries of the world. The Metaverse Doctors Association, started by a neurosurgeon from Seoul, I understand has now got a membership of more than 500 people. And as you can see in this slide, it's a program of virtual learning experiences. I am delighted that Neurological Society of India, the Educational Program Committee, etc., are conducting so many webinars. And I dream that in the next few years, the members of the NSI will all be wearing augmented virtual reality goggles, and from the comfort of your home. I am now sitting in my home, and from my house, I'm able to talk to every one of you. It is just a question of time before I'm able to wear goggles and see the most fantastic neurosurgical procedures being done all over the world. This is the theater, not of tomorrow, but of today. It is very difficult to capture this in a slide format, but this is what the cardiac surgeon sees before doing a thoracotomy. We are talking of minimally invasive surgery everywhere. The cardiac surgeon will be able to get into the cuffs and the leaflets of the bicuspid valve or the tricuspid valve. And this is what is going to happen. The theater of tomorrow. You will be seeing holographic pictures like this in 3D. You will be able to get inside the brain. Of course, the functions for the brain may be quite different from that using for the heart. Use case flying a drone. Imagine a demented patient in a ward. He is told, come on, make the drone fly, make the drone take off and land. Nothing could be more exciting to this, particularly if a person is inside a hospital, 50 years old or 60 years old, and you can look at this complex slide, how just by looking based on the gaze position data on how much adduction, abduction have taken place in the medial rectus, the lateral rectus, and so on, he is able to stimulate and trigger a real drone which is outside the hospital room. He is able to allow the drone to take off and even land. Based on eye tracking devices, you can see the partly demented patient sitting on a wheelchair on the lower right. So this is the future. This is how augmented and virtual reality are going to be used. No function succeeds anywhere in the world. It's a fact of life. Unless it is economically viable, nothing is going to really take off. Enormous amount of studies have shown that virtual rehabilitation, including neuro-rehabilitation particularly, they foresee, based on extrapolation of present data, that this is a huge, huge market. And you find that hundreds of companies have got into the bandwagon and have already started investing not millions, but billions of dollars to spend on augmented virtual reality. When my nephew's son in the United States, a 12-year-old boy, was spending his entire time on games, I, as an old-fashioned senior citizen, I was very annoyed, concerned, etc. And I said, what is this boy going to do? He's spending 8 hours a day playing games. But today, these games are being adopted. They are not FDA-approved software as a medical device. And even in India, as I said, we are funding some projects where we are going to use games in the management of demented children. This will be culture-sensitive games in the local language. So I believe that using games is also going to play an important role in the management of neurological and psychiatric patients. cognitive tele-rehabilitation. I require much more time to go into all these details, but all of you can understand how detection of stress, how haptic stimulus, knowledge database, exercise database, with all this. The beauty of this is every one of this can be customized, tailor-made. It is cost-effective, need-based, appropriate technology. It is not too difficult to convert this entirely to the Marathi language or the Punjabi language to suit people with an IQ of 80 to 100, or it can be redesigned to suit people with an IQ of 150 and so on. Perhaps the no more cadavers is not the correct statement, but certainly the number of cadaveric dissections is going to become less and less in the future, because computer simulations have been absolutely incredible. And you can cut, you can make mistakes, you can do all the proper operative misadventures, which we of the 20th century, we learned the very hard way. We learned by making mistakes, but tomorrow you will make every single mistake which your seniors all made, you will make it in the laboratory using a computer simulation. It is very investment that people have already started selling. Can you imagine this? They have already started selling 1 acre of mountainous area, a lake area, etc. in the metaverse. And some governments in Europe have even said the metaverse is being slammed by sales tax, taxation. You may have to pay property tax and water tax on 2 acres of land which you own in a virtual setting. In one of the countries, I just forget which country it is in the Europe, the parliament has already made, has suggested that medico-legally a person should be held guilty of homicide if he kills somebody in the metaverse. This has already started happening. I cannot physically kill somebody, so I let loose all the emotions, my pent-up emotions, by killing this person on the metaverse. So this is what is going to happen. The benefits of the metaverse are tremendous. Radiology, for example, medical wearables, and HIPAA guidelines. FDA, as I told you 2 years ago, started a new division called software as a medical device. I understand that there are several applications specifically of using AVR, extended virtual reality, Internet of medical things, etc., pending before the FDA. And I believe it's only a question of time before the government of India, the appropriate agency, will also be approving various aspects using augmented and virtual reality in the therapeutic armamentarium of a doctor. Healthcare education enables students to receive better education. Students studying the human anatomy with virtual reality glasses will be able to identify something much more. Gone are the days where anatomy department was in one place, physiology department was in another place, biochemistry department was a professor of biochemistry. I foresee the day is not far off when every one of this will be integrated. We are talking of integrated anatomy, pathology, physiology, biochemistry. In other words, in the future, it could be a department. Okay, that's exaggerating too much. It could be a division of whatever is appropriate term of multiple sclerosis, of gliomas, and the anatomy, physiology, pathology, neuroimaging, biochemistry, etc., 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 of multiple sclerosis will be taught to the patient. And I believe, based on perusal of the world literature, that in the next few years, you may get certified, not as a board certified in neurosurgery, but not even in neuroendoscopy, not even in skull-based surgery, but you may be specially trained for a group of diseases and not an MCH in neurosurgery. The neurosurgery training program of today will totally have to be redone. There could be a general neurosurgeon familiar with the bread and butter neurosurgery, but you will not be allowed to do a stereotactic radiosurgical procedure unless you are formally trained in stereotactic radiosurgery and so on. Curricular implementation in neurology education, all this is published in the literature, and there are so many organizations already using this and comparing this, double-blind, randomized control studies. It's amazing to see the interest, cost-benefit analysis, redefining. You need to unlearn, you need to relearn, The entire system of training, of education is going to totally change because the way the metaverse is going to be used in the future. Imagine this. A virtual medical city has already been planned for Singapore and Indonesia with a virtual citizenship of 2 to 3 million. Companies have already started this and they're going to implement this very soon. You can see here the Singapore-based Meta Health Limited is planning. The Netherlands is a blockchain medical company, has established what it calls the so-and-so medical city. Hospitals and accredited medical providers can open virtual clinics. We are talking of cryptocurrency. We are talking of non-fungible tokens, etc. Gone are the days of conventional medical practice. Imagine wearing a t-shirt with 30 to 40 QR codes. Today, India probably is a leader in the world. Just 3 days ago, when I was walking across one of the very small streets in Madras, we wanted to buy some jasmine flowers. 15 rupees for one foot of jasmine flowers. And I was struggling to take out the money. And this young girl sitting on the roadside pointed out a QR code and said, "Sir, why don't you GPay?" This is what is happening in the towns of India. So it is not at all surprising that my children, the next generation will be, grandchildren certainly, will be wearing t-shirts like this. You focus your smartphone on a QR code and you will be able to get into the pericardium, the endocardium, and so on. These are photographs I took of the Times of India newspaper coming to Madras. Can you imagine a full-page article to get the metaverse ready, convert your product inventory into 3D? Metaverse will be transformational. You must prepare now for the new world. Indian companies, big and small, are building technology for the metaverse. Virtual reality will change hospital experience. Apollo to collaborate with virtual reality firm, and so on and so forth. In the city of Chennai, just a few kilometers away from where we live, Apollo Simulation Center was started a year and a half ago. I understand it's one of the biggest in the country. I spent a couple of hours going around. It was a fascinating experience for somebody like me, trained in the 20th century. 8,000 square feet. You can see deliveries. Every type of delivery is being simulated, whether it is breech, twins, triplets. How often would an MD or even a DGO student actually deliver triplets? Today, you can do every one of this. And in conclusion, I think I'm delighted to have played a very close role with the Neurological Society of India for the last 45 years, starting from 1975. And 3 years ago, Sanjay Bihari had the foresight to accept my request to bring out a special publication on extraterrestrial neurosciences. Every one of these articles have been downloaded several thousand times, and I'm absolutely certain that in the next 8 to 9 years, ISRO is already next year, because of the COVID, everything got delayed. Next year, the Gaganyaan mission will certainly take off. 3 Indians are going to be in low Earth orbit. In 10 years from now, NASA has already made all the details. The first manned mission to Mars is going to take place. The first surgical procedure using the metaverse, the first surgical procedure is going to be carried out at the ISS, the International Space Station, in about 5 months from now. The surgical robot is already headed for space, and you can see here how in microgravity, in the presence of irradiation, this autonomous surgical robot will be controlled by somebody from NASA, and they will be able to stitch, they will be able to cut, they'll be able to put a catheter and so on. Ultrasound imaging, this is the ultrasound, recently FDA approved. Clinical trials are going on. It's just a question of time before patients will start wearing these patches and go home with these patches. Constant ultrasound imaging will take place, connected to the cloud, and the appropriate specialist will be able to see the internal organs while the patient is in his house. Whether this has got applications, transcranial Doppler through a small acoustic window in the temporal bone. Today it is possible to do a near infrared spectroscopy even through an intact adult skull. I believe the way technology is proving, I will not be surprised if we are able to do an ultrasound imaging through an intact skull, certain acoustic windows in the intact skull, wearing a patch like this. So ladies and gentlemen, this is the future, and this may sound futuristic. Most of us are afraid of the future. We cling desperately to the present, not realizing that we have already become the past. When I started radio surgery in 1995, everybody laughed and ridiculed. They said the neurosurgeons who cannot cut and stitch go in for non-invasive procedures. Today, the most aggressive skull-based neurosurgeons in the world agree that there is a role in selected cases for non-invasive stereotactic radiosurgery. When telemedicine was contemplated in 1998, everybody laughed and ridiculed. Today, remote healthcare is slowly being integrated into the healthcare system. I firmly believe that even though this may sound very unrealistic, on the one hand, we say we are not drinking water, we don't have enough money, cholera, diarrhea, dysentery. When we talk of cholera, diarrhea, and dysentery, this guy is talking about the metaverse. But believe me, the metaverse is going to help you treat cholera, diarrhea, and dysentery. You can ignore reality, but you cannot ignore the consequences of ignoring reality. If Moses was to come back to earth, I think every one of the 10 commandments will have the prefix, thou shalt digitally transform. You cannot have a healthcare provider. I'm not using the word neurosurgeon because I believe that the healthcare provider, a new genus, a new species will take over, not even necessarily being a doctor, but handheld by a neurosurgeon. The healthcare provider will be able to deliver adequate, reasonable, good neurological care to the 970 million Indians who today live in areas where there's not a single neurologist or neurosurgeon. This is possible only with digital transformation. And I believe what constitutes the metaverse today is going to play a very major role in the development of healthcare and to bridge the tremendous urban-rural health divide, which is slowly becoming lesser and lesser. I could go on and on, but I think I'll stop with this. Thank you once again for inviting me to share with you my thoughts on the metaverse.
Thank you, Professor Ganapathy, for that amazing talk. I think it must have excited many of us, especially our young generation. They will face it much more.